Hi there, how are you doing today?
I'm good. How are you doing?
I'm doing very well. So, if you could for us, please just introduce yourself, give us your name, your title, a short bio about yourself, your credentials, and then state the title of the article you'll be talking about today.
Sure. So I'm Dr. Laura Swoboda. I'm a translational scientist, a family nurse practitioner. I'm also a skin and wound specialist in Milwaukee, Wisconsin. And today we're talking about my article on foot assessment and care.
Amazing. So, could you briefly give us an overview of why nurses should read this article?
Yeah, absolutely. So nurses should be reading this article to be better prepared to prevent complications and also to provide education. So for the foot to properly work, we have, 26 bones, there are 33 joints, over 100 tendons, ligaments, blood vessels, nerves. Everything needs to work together for the foot to function properly. So it's no surprise that that doesn't always happen. And actually 75% of Americans will experience foot problems in their lifetime. That is especially prevalent in the elderly who have trouble inspecting their feet or caring for their feet, usually due to visual deficits and, dexterity issues, those types of things. So nurses are a key piece to be able to teach people how to better assess their feet and also do that assessment for people who may be unable to do so.
Amazing. So, obviously, this is a very important topic because, as we all know, everyone has feet. So, what made you want to write an article on this topic specifically?
Yes, yeah. So this is an opportunity for early problem identification. I want nurses to feel more comfortable being able to see those early signs of a problem. As a wound specialist, I see the downstream effects of poor foot care. So people that have untreated issues that will lead to ulcerations, to bone infections, amputations, and sometimes death. So a lot of people aren't aware that a diabetic foot ulcer has the same 5-year mortality rate as cancer. It's 30%. So if we can pick up on the signs of foot issues early, we can better intervene and hopefully have better outcomes for people.
And obviously, there's going to be a lot that's going to be in this article and with foot care in general. So there's going to be a lot of information for these nurses to take in. But if you really want them to zero in on 2 to 3 things that are the most important that you really want to make sure that they remember, what would those 2 to 3 things be?
Yeah, so I think this article does a good job of distilling the foot assessment and foot findings from that assessment into a readable piece that you don't have to spend hours studying. It's something where you can, take the time to read the article and then immediately the next day in your practice feel better how to assess the foot and what you might find when you're doing that. Looking at 2 to 3 specific things. Increase comfort with that 3-minute foot assessment. So this is a evidence-based foot assessment tool that the patient can, you ask them questions about their feet. You look at both feet if there are two, or the foot, and feel a little bit more comfortable knowing the signs of peripheral arterial disease, of diabetic neuropathy, seeing what rubor looks like, what pallor looks like, nail dystrophy, and what can cause nail dystrophy, and then calluses, and what is the significance of a callus, in people without diabetes and people with diabetes. So I'd also like nurses to walk away feeling more confident in teaching their patients. This article includes evidence-based foot care recommendations from some quality associations and evidence-based guidelines that are distilled into a very readable, shareable document. You can copy and paste it, share it widely, get the message out there of how people should be caring for their feet to protect them from outcomes, down the line.
Amazing. Well, Laura, thank you so much for writing this article for American Nurse. We really appreciate it. And we also appreciate you sitting down to give a little insight on the behind the scenes of this article from you.
Yeah, absolutely. Thanks for having me.